This is the Coronavirus Daily Briefing for Friday, March 13th, 2020. I'm Brian McCullough. Everything feels like it's canceled. Steps are taken to increase testing, but more stories of people being denied testing surface every hour. People emit high levels of coronavirus early, but are likely not infectious while recovering, and what you should actually do in concrete steps if you do come down with coronavirus. As of this morning, there were 1,701 COVID-19 cases in the U.S., an increase of 378 from yesterday. Around the time this episode is released, President Trump is scheduled to hold a press conference that lots of sources say will include a declaration of a national emergency. I'm sure you have heard Disney theme parks are closed. Broadway shows are dark. Basically, like all of the sports have suspended their seasons. Canadian Prime Minister Trudeau's wife has indeed tested positive for the disease. An Australian minister tested positive days after meeting with U.S. Attorney General Barr and Ivanka Trump. Senator Lindsey Graham is in self-quarantine after meeting with an infected person, presumably the same person that interacted with President Trump at Mar-a-Lago. The White House says President Trump and Vice President Pence will not be tested for coronavirus because, actually, I don't know why. The Trump administration has announced steps to increase the availability of testing, quoting the Washington Post. The Food and Drug Administration has created a 24-hour emergency hotline for laboratories having difficulty getting materials or finding other impediments to running tests, according to announcements early on Friday. Officials also announced they were giving nearly $1.3 million in federal money to two companies trying to develop rapid COVID-19 tests that could determine whether a person tests positive within an hour, end quote. Ohio, Maryland, New Mexico, Oregon, Michigan, and Washington, D.C. are shutting down schools entirely. Kentucky has urged all schools in the state to shut down, but did not mandate it. New York City schools have not yet closed, but I can tell you anecdotally, on the ground here in the city, I can't believe that will last much longer. Mayor of the city, Bill de Blasio, said yesterday in a press conference, quote, "I'm very sad to offer this prediction. I think we'll be at 1,000 cases next week," end quote. Connecticut's chief epidemiologist said yesterday that he expects around 10 to 20% of the state's residents will contract COVID-19. Ohio officials estimated that 100,000 people in that state probably already have COVID-19. Quoting the New York Times, in Britain, the government has so far resisted taking extreme measures. Shops, schools, and pubs were open. Mass gatherings have not yet been banned. More stringent measures were being held in reserve, end quote. And overnight, China reported 8 new COVID-19 cases for yesterday. So that's good news. There were 7 new deaths, though they reported 88 new cases coming in from outside of China. So sort of a glass half full, half empty situation. China's internal cases continue to plummet, but they are now a net importer of cases as the rest of the world is now going through what they went through months ago. But also this. Jack Ma is the founder of the huge Chinese tech platform Alibaba. Jack Ma is a billionaire, one of the wealthiest men in the world. He has the Jack Ma Foundation as his philanthropic arm. And last night, the Jack Ma Foundation tweeted it was donating 500,000 testing kits and 1 million masks to the U.S., saying, quote, "We join hands with Americans in these difficult times," end quote. As David Wallace Wells, deputy editor for New York Magazine, tweeted, "A single Chinese billionaire is providing more testing kits to Americans than the CDC and the entire federal government has managed. And not just a few more by many orders of magnitude," end quote. Hopefully this news pans out as true and does so sooner rather than later. On the testing front, a new coronavirus test being touted as 10 times faster has received emergency approval from the FDA. The test comes from pharmaceutical maker Roche, quoting Bloomberg. The U.S. Food and Drug Administration granted an emergency use authorization to the test, which runs on Roche's Cobas 6800/8800 systems. The tool also is available in Europe and countries that accept its CE marking for medical devices, Roche said. The 8800 version is capable of testing 4,128 patients a day, and the 6800 can test as many as 1,440 Quote, "We are increasing the speed, definitely by a factor of 10, Thomas Schrinker, head of Roche's diagnostics unit, said in an interview. This is the third test and first commercially available one granted emergency approval by the FDA. The Cobas 8800 system can test patients about 10 times faster than Roche's existing test for the coronavirus, which runs on its Magna Pure 24 and the Light Cycler 480 devices. While those instruments require more human attention, there are more of them in labs and hospitals around the world. They'll continue to play a crucial role in testing people, especially outside the U.S., Schrinker said. The Cobas 6800, 8800 instruments provide test results within 4 hours. Roche can provide millions of tests every month for the systems and is, quote, going to the limits of its production capacity, the company said. Roche declined to comment on pricing for the tests, end quote. Scott Gottlieb, former FDA commissioner under President Obama, tweeted, quote, "Very significant approval. Will substantially increase patient testing capacity by end of next week by tens of thousands a day across all labs, commercial and academic. Will take time for labs to stand up these platforms, should roll out next week," end quote. We could really use something, anything, quickly. The Washington Post's West Africa bureau chief reports that the African country of Senegal is currently testing people and giving results within 4 hours. Senegal's per capita income is less than $3,000 a year. Americans are being denied COVID-19 tests even when their doctors want them tested. The Washington Post reports that test denials are happening across the country, flying in the face of the administration's constant assurances that, quote, anybody that needs a test gets a test, end quote. Yesterday, Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, admitted to the House Oversight Committee that the testing system in the U.S. is, quote, failing. He added, quote, the idea of anybody getting it easily the way people in other countries are doing it, we're not set up for that. Do I think we should be? Yes, end quote. Quoting from the Washington Post, the number of medical professionals and patients who are denied access to tests is not tracked nationally. But in interviews, people from states as varied as Wisconsin, North Carolina, Washington, Indiana, and New York said their doctors sought but were unable to get testing approval from local or state health officials, end quote. The paper cited numerous examples of people who developed symptoms consistent with coronavirus, even including people who had returned to the U.S. from overseas who were still unable to get tested. Time and again, studies that we've covered on this podcast have indicated that early mass testing is vital to public health agencies' ability to respond to an outbreak. Quoting again from the Washington Post, limited testing in the early days of disease transmission not only increases the risk of the disease being spread by people who don't realize they have it, but also affects the ability of public health officials and hospitals to plan for a prolonged outbreak, end quote. An airplane passenger flying from New York's JFK Airport to West Palm Beach on Wednesday night learned toward the end of the flight that he'd tested positive for the coronavirus. The passenger was overheard talking about the notification, and the flight was met by medical authorities when it landed at West Palm Beach a short time later. Quoting from the New York Times, passengers from that flight came through Palm Beach International Airport in Concourse A, which was shut down for cleaning on Thursday. The airport was otherwise operating normally, a spokeswoman said. At JFK, employees cleaned the gate, security checkpoints, kiosks, restrooms, and, quote, any other area the passenger went through based on security camera footage, according to the Port Authority of New York and New Jersey, which runs the region's airports, end quote. JetBlue said in a statement that they're, quote, asking customers who do not feel well or are concerned they may have coronavirus to not fly until cleared to travel by a doctor or health professional, end quote. The Times reported that it's not clear whether or not the passenger in this case had been advised to travel or not. Also, it seems like all the people on the plane were just told to go home and self-isolate on their own recognizance, I guess. The U.S. healthcare system could be overwhelmed by a large number of new coronavirus cases, a new analysis by the New York Times has warned. Aaron E. Carroll, a professor of pediatrics at Indiana University School of Medicine, wrote plainly, quote, As a medical doctor who analyzes health issues for The Upshot, I strive to place your fears in context and usually tell you that you shouldn't be nearly as afraid as you are. But when it comes to the nation's response to the new coronavirus, I cannot be so reassuring, end quote. Carroll pointed out that the key figure in understanding how America may fare in the event of a COVID-19 case spike is the number of Americans who may get sick at the same time, because the U.S. has, according to OECD numbers, only 2.8 hospital beds per 1,000 people, fewer than Italy, which is currently struggling to cope with an outbreak spike. Quoting from the New York Times, "The cautionary tale is Italy. More than 12,000 people have been infected there. More than 800 have died. A little over 1,000 have recovered. Many of the rest are ill, and a significant number of them need to be hospitalized right now. This has exceeded Italy's capacity for care. It doesn't matter what physicians' specialties are, they're treating coronavirus. As healthcare providers fall ill, Italy is having trouble replacing them. Elective procedures have been canceled. People who need care for other reasons are having trouble finding space. In an unthinkable fashion, physicians are having to ration care. They're having to choose whom to treat and whom to ignore. They're having to choose who will die. Italy, especially northern Italy, has a solid healthcare system. It might not be the best in the world, but it's certainly not lacking in ability. It's just not ready for the sudden influx of cases. There aren't enough physicians. There's not enough equipment. The United States isn't better prepared," end quote. As you know, if you've been listening all week, that is generally repeating something that we talked about earlier in the week. But in the absence of a vaccine, it remains imperative that we limit the number of people who get sick at the same time through other measures. And at this point, that probably only means one thing: social distancing. A new study says non-pharmaceutical interventions, that is, early detection and contact reduction, otherwise social distancing, introduced by China in the wake of coronavirus, are effective and should be implemented quickly elsewhere in the world to prevent further spread. According to The Guardian, the analysis found that China's caseload could have been as much as 67 times higher by the end of February had the country not introduced stringent lockdown measures in Wuhan and elsewhere. It also found that if China had been able to act 1 week sooner, the infection rate would have been reduced by as much as 66%. And if the measures had been implemented 3 weeks sooner, that reduction would have been as much as 95%. Professor Andrew Tatum of the University of Southampton, England, told The Guardian, quote, "From a purely scientific standpoint, putting in place a combination of interventions as early as possible is the best way to slow spread and reduce outbreak size. The study looked specifically at 3 interventions: early detection, social distancing, and travel restrictions." Professor Tatum explained to The Guardian, quote, "Of the 3 types of intervention we looked at, the early detection and isolation of cases likely had the strongest impact, and this is something that seems to have been in place early and been done effectively in the UK compared to other countries such as the US. The other 2 types of interventions, social distancing and travel restrictions, I think do need to be looked at seriously in the coming days," end quote. Early detection emerging as the key intervention does, of course, once again throw the current paucity of testing in the US into sharp relief. A link to the study, which has yet to be peer-reviewed, is in the show notes. People who get coronavirus are highly contagious early in their infection, a new study suggests, which may go some way to explain why the virus seems to be so easily transmitted. The study, link as always in the show notes, revealed that peak concentrations of viral shedding, that is how much virus is emitted, are reached within 5 days of infection, quoting from STAT. The researchers found very high levels of virus emitted from the throat of patients from the earliest point in their illness, when people are generally still going about their daily routines. Viral shedding dropped after day 5 in all but 2 of the patients who had more serious illnesses. The 2 who developed early signs of pneumonia continued to shed high levels of virus from the throat until about day 10 or 11. This pattern of virus shedding is a marked departure from what was seen with the SARS coronavirus, which ignited in an outbreak in 2002-2003. With that disease, peak shedding of virus occurred later, when the virus had moved into the deep lungs. Shedding from the upper airways early in infection makes for a virus that is much harder to contain. The scientists said at peak shedding, people with COVID-19 are emitting more than 1,000 times more virus than was emitted during peak shedding of SARS, a fact that likely explains the rapid spread of the virus. The SARS outbreak was contained after 8,000 cases. The global count of confirmed COVID-19 cases has already topped 110,000, end quote. On what is perhaps a more positive note, At the same time, the study suggests that while people with mild infections can still test positive by throat swabs for days and even weeks after their illness, those who are only mildly sick are likely not still infectious by about 10 days after they start to experience symptoms. The study also noted that people who are infected begin to develop antibodies to the virus quickly, typically within 6 to 12 days. The rapid rise of antibodies might explain why about 80% of people infected with the virus do not develop severe disease, end quote. As we've discussed previously, there are currently no specific antiviral treatments for COVID-19, and we're probably a year to 18 months away from having a vaccine. So what do you do if you actually get infected by coronavirus? What should you have on hand, and when should you get help? If you think you're getting sick from coronavirus, the first step, according to Harvard Medical School, is to contact your doctor for advice, or if you don't have a doctor, your local board of health, who will direct you to the best place for evaluation and treatment near you. Coronavirus often presents like a bad cold or flu. Your doctor may suspect coronavirus if, according to Harvard, quote, you have respiratory symptoms and you recently traveled to countries with ongoing community spread of the COVID-19 virus, including China, Iran, Italy, Japan, South Korea, or you have been exposed to someone suspected of having COVID-19, or there has been community spread of the virus that causes COVID-19 in your area, end quote. Well, I think that last bit might be the U.S. at this point. So-called mild symptoms of coronavirus include fever and cough, according to the CDC. These may appear 2 to 14 days after exposure. Harvard recommends not going to the ER unless you have more severe symptoms, which they say are, quote, high or very low body temperature, shortness of breath, confusion, or feeling you might pass out, end quote. These require prompt medical attention. Harvard recommends calling your emergency department ahead of arrival to let them prepare. As always, if you have a medical emergency, call 911. If you get sick, Harvard suggests taking these steps. Quote, while you don't need to stay in bed, you should get plenty of rest. Stay well hydrated. Take acetaminophen, ibuprofen, or naproxen to reduce fever and ease aches and pains. Be sure to follow directions. If you are taking any combination of cold or flu medicine, keep track of all the ingredients and the doses. For acetaminophen, the total daily dose for all products should not exceed 3,000 milligrams, end quote. And if you have to stay home for a couple of weeks while the virus runs its course, what should you have on hand? Having a couple of weeks worth of those over-the-counter medications we just mentioned to help with symptom management is a good idea. This would include Tylenol, ibuprofen, which is Advil, and or Aleve, which is naproxen, to help relieve fever and pain. If you take prescription medications, Harvard recommends keeping at least 30 days stock on hand. You might be able to get a 90-day supply by contacting your doctor. Other items on Harvard's recommended list, quote, cough and cold medicines, anti-diarrheal medication, thermometer, fluids with electrolytes, soap and alcohol-based sanitizer, tissues, toilet paper, disposable diapers, tampons, sanitary napkins, and garbage bags, end quote. Typical cough and cold medicines include Mucinex, Robitussin, Dayquil, and NyQuil. Check the ingredients to make sure you are not duplicating the dose of a particular medicine. Links are in the show notes to the CDC and Harvard pages referenced in this segment for more details. Those are the bottom links in today's show notes. That's all for today and this week. Please, if you find this show useful, tell everyone you know about it. I've already heard from folks for whom this is their first ever podcast they've listened to. I heard from someone who taught her elderly parents how to download podcasts so they could listen. I'm going to end today with this. In Siena last night, the residents of Siena, Italy, in lockdown, obviously, took to their windows to sing a popular song out into the empty streets of their town. I offer you this with, I'm not going to lie, chills. This is going to be a difficult weekend, everybody. We'll talk to you on Monday. Be well.